Hello friends, welcome to the new session of Hospital and Clinical Pharmacy. Myself Ms. Malvi Rajendra Bhavsar, KK Institute of Pharmacy, Nashik. So today we are going to discuss about Formulary System. New chapter, Hospital Formulary System. After watching this, student will be able to learn what is hospital formulary, what are the guiding principles for hospital formulary, significance of hospital formulary and contents of hospital formulary. Okay, so first we'll start with what is hospital formulary. Now the PTC, as we have seen, selects from so many medical preparation available and dosage form available, those that are considered most useful in patient care. The selection is based on the evaluation of this preparation against needs of patient. The compilation of a selection preparation by a hospital is called a hospital formulary. It reflects the current clinical judgment of medical staff. The formulary provides for obtaining, prescribing, dispensing, and administering the both both branded and generic drug. In India, majority of hospitals have their own formulary, which is adopted from the national formulary prepared by the Ministry of Health and Government of India. Then, what are the guiding principles while using the hospital formulary? So, the guiding principles include PTC is formed in the hospital, so it has representatives of medical and pharmaceutical staff. The PTC recommended certain drugs to the formulary on the basis of opinion of medical staff. The needs of specific hospitals are kept in the mind while designing a formulary. The whole process is subjected to administrative approval. The policies with respect to formulary drugs adopted by the organization as a whole are enshrined in the formulary in writing or are communicated in some other way to the medical staff. The policy should not violate prescribers' judgment in respect of non-proprietary drugs or should not allow the substitution of prescribed drug. However, this discretion is solely that of the physician either to stick to a drug prescribed or a change. Generic prescription through encourage physicians should have some freedom to prescribe brand names. Nomenclature is left to the physician's discretion. When there is no formulary, the pharmacist has to obey the physician's prescription too. He can consult the physician when the prescribed brand is not available. The nursing staff should inform about operation of formulary. Substitution is not respectable term since it has unauthorized dispensing connotation. Such a term is better to avoid for formulating policies because when formulary is adopted and operated properly, there is no question of substitution. The content and the working of hospital pharmacy may undergo change, which must be communicated to the medical staff. Formulary is revised by the medical staff to consider inclusion of excluded drug. Flexibility is necessary to provide for the investigational drug. Then the PTC advises and guides the pharmacist regarding the purchase and the procedure of purchase. The labeling should follow an adopted format. The format for non-proprietary drug is as follows. First, name of drug, then name of manufacturer, prescription order or order by proprietor, dispensed in accordance with formulary policy, maybe another brand or with the same content. The legal significance of formulary system. A prescription constitutes a legal permit to dispense or administer a particular drug. The prescriber may write the generic or chemical name. So, example, aspirin tablet. The pharmacist is within his right to dispense or administer a brand that comes very close to it. So, example, he can dispense Aspro, Anacin, or aspirin of any licensed manufacturer. When the formula is adopted and the prescriber continues to prescribe the brand, the pharmacist has to obey him and dispense only the brand prescribed. To overcome legal hitches, legends like generic equivalent permitted or dispensed in accordance with the e-hospital formulary are printed on the e-prescriptions. Then Decision on which the PTC is expected to take. The first important decision is regarding having one's own formulary or a simple list of drug or a catalog would suffice. National Formulary of India or a formulary compiled by the Central Purchasing Organization can be adopted. Once it is decided to have formulary, the contents of other than drug included are also to be decided. So first can be prescription writing, use of drug, diagnostic, toxicology, posology, other useful tablet data, and format of formulary like size, whether loose leaf or bound printed or cytosolited indexing, etc. So first content is prescription. They have to be clear, legible, and mention the name and address of the patient. So prescription should contain each and every data properly, including the information of patient, information of doctor, proper medications which he has prescribed, with quantity, dosage regimen, dosing frequency, etc. Metric in metric terms. Then other data should include normal lab values, weight and measures, percentage calculation, mean equivalent and dosage, reagents and components. Then loose leaflet formats are there, bound volumes are there. Okay, so indexing and category assignments. At times, items have been categorized and indexed suitably for easy access or location by the user. Most of the formulary carries general index at the end of text. The index is alphabetical by generic drug. The cross indexation in the text of brand or for a generic drug is given. The formulary with general index presupposes. Okay, the last part of this topic is selection of text. What will the monograph of each drug carry? Okay, it all depends upon the objective set up by PTC. Text should give the name of generic drug, its formula if any, alternative name, its action and use in brief, the dosage regimen and the side effects. It should also mention the precautions, contraindication and treatments of a toxic event. Dosage form available should be mentioned, advice for the patient can be given. Okay, so this is the sample given under the text. Okay, so the example is of betamethasone, a corticosteroid. So what information must be given? So first is 0.5 milligram tablet, that is a strength, and bottles of 100 tablet is there. Okay, then composition, each tablet contain betamethasone IP 0.5 milligram. Then there is a description of that tablet. Okay, then indications regarding that drug, dosage and administration, what dose is given to adult. Okay, what dose is given for short term? The dose is given is 2 to 3 milligram. For the treatment of arthritis, 0.5 to 2 milligram daily. Okay, then most other conditions, 1.5 to 5 milligram daily for 1 to 3 weeks. Then for children, fraction of adult dose may be used. What are the contraindications? It is contraindicated in systemic infections, then hypersensitivity to component of tablet and during live virus immunization. The precautions regarding tablets, side effects, overdosage means treatment is unlikely to be needed in case of acute overdosage. And further information, beta-alanine does not normally cause retention of salt and water, and the risking of inducing edema and hypertension is almost negligible. Thank you very much, friends, for your patience listening. Thank you.